Are we ready to get started? Good morning. Hello, everyone. Bonjour tout le monde. Thank you for the warm welcome. What a great center. My name is Maggie Chi. I'm the Member of Parliament for Don Valley North, Parliamentary Secretary to the Minister of Health. Before I begin, I want to acknowledge my colleagues who are here. So in the audience, we have City Councilor, Local Councilor Ralston King, Ward 13, Rideau Rockcliffe, and I have my colleagues from Member of Parliaments here, Jean-Yves Duclos, Mike Galloway, Guillaume Deschamps-Thériault, Giovanna Mingularli, Sima Akran, and the local member here as well, Mona Fortier. I would like to acknowledge that we are gathered here on the traditional and ceded territory of the Algonquin and Anishinaabe people. And I'm happy to be here today at the Rideau Rockcliffe Community Resource Center. This place is a hive of activity and serves as a dynamic focal point for this community. I want to thank the service providers here for the warm welcome this morning, at the RRCRC for all the outstanding work you do here to support the people of Ottawa. That work includes connecting residents with dental services, which are so important for maintaining good health. The Canadian Dental Care Plan, which was introduced in late 2023, is helping to make these services accessible to more and more people in the community and beyond. Today, I had the pleasure of being here today to introduce my colleague, the Honorable Marjorie Michel, Minister of Health, who's going to talk about how that plan is improving the health of people all across Canada. Minister Michel was elected last fall as the member of Parliament for Papineau, Quebec, and was appointed Minister of Health thereafter. The minister was born in Haiti and holds a master's degree in social work and organizational psychology from Catholic University of Louvain in Belgium. When I see my colleague MP Yasser be here, as well as a certificate in the Diplomatic and Strategic Study from the Center for Diplomatic and Strategic Studies. In the 1990s, she served as an advisor to the Haitian Embassy in Paris. As of 1995, she became responsible for the coordination of logistics for the General Assembly of the Organizations of American States. Later, she turned her passion to politics, leading numerous election campaigns and making history as Canada's first Black woman to be appointed as Deputy Chief of Staff to former Prime Minister Justin Trudeau. Minister Michel values a deeply inclusive approach, advocating for social equity, equality, mental health, and reconciliation with Indigenous communities. It is my privilege to call her my colleague, my mentor, and to share the podium with her today. Ladies and gentlemen, please join me in welcoming the Honorable Marjorie Michel.
Good morning, everyone. Merci beaucoup à tous mes collègues qui sont derrière moi. Vous ne savez pas à quel point ça me donne du confort et de la force de vous avoir avec moi aujourd'hui, surtout que vous représentez différentes régions à travers notre pays. Before I begin, I want to thank the Rideau Rockcliffe Community Resource Center for hosting us today. Today marks an important milestone for Ontarians and all Canadians. Aujourd'hui, nous soulignons une étape importante pour les Ontariens et tous les Canadiens. Le régime canadien de soins dentaires est l'un des plus importants programmes sociaux de l'histoire de notre pays. C'est une bonne nouvelle. Et chaque jour, plus de Canadiens ont accès aux soins dentaires abordables dont ils ont besoin. Close to 2.8 million have already received care, saving them on average close to $800 per year. Wow. This program is not just about providing financial support. It is about improving lives. People suffering with chronic dental pain are now getting treated. Canadians are receiving the preventive care they need. All of this helps to ease the burden on Canada's healthcare system with fewer non-urgent trips to the emergency room for issues that could be treated in a dental office. Ce régime ne vise pas seulement à rendre les soins dentaires plus abordables, mais il vise aussi à améliorer la qualité de vie. Les personnes souffrant de douleurs dentaires peuvent désormais se faire soigner. Les Canadiens reçoivent maintenant les soins préventifs dont ils ont besoin. Tout cela contribue à alléger le fardeau qui pèse sur le système de santé en réduisant le nombre de visites aux urgences pour des problèmes qui pourraient être traités en clinique. Last May, our new government expanded the Canadian Dental Care Plan to include millions of new eligible Canadians. Today, we announced that more than 5 million Canadians are currently covered under the Canadian Dental Care Plan. We should note when we put the program in place that we were aiming to reach to 8 million people. So it's a great milestone. Aujourd'hui donc, nous annonçons que plus de 5 millions de Canadiens et Canadiennes sont présentement couverts par le régime canadien des soins dentaires. This means better access to affordable oral health care for millions of our friends, neighbors here in Ontario and all across the country. At a time of rising living costs, the peace of mind that comes with knowing that your health needs will be met is priceless. The Canadian Dental Care Plan is having a profound impact on the lives of Canadians, improving both health and affordability for eligible members. The strong uptake for the CDCP underscores the need for affordable oral health care across the country and the important role that all oral health providers play in improving the overall health of Canadians. That's why I would like to end by extending my heartfelt appreciation to all of the dentists, denturists, hygienists, and specialists who are participating in our dental care plan. This program is only possible because of the commitment and participation of almost all providers across the country. Thank you. You are improving Canadians' health one appointment at a time. You, more than anyone else, know that we cannot build a Canada strong without protecting and improving the health of Canadians. Je voudrais terminer en exprimant ma sincère gratitude à tous les dentistes, denturologistes, hygiénistes et spécialistes qui participent à notre programme. Ce programme n'est possible que grâce à l'engagement et à la participation de presque tous les prestataires à travers le pays. Vous améliorez la santé des Canadiens, un rendez-vous à la fois. Vous savez mieux que quiconque que nous ne pouvons bâtir un Canada fort sans protéger et améliorer la santé des Canadiens. Merci beaucoup à tous.
Thank you, Minister. And next up, we have a speaker. Mona Fortier is your local member parliament, parliamentary secretary to the Minister of Foreign Affairs and member parliament for Ottawa, Vanier, Gloucester. Here she is.
Bienvenue chez nous. Hein? Je suis tellement contente de voir autant de gens présents de la communauté et merci Madame la ministre Michel, mon amie Marjorie, et bonjour à tous et à toutes. Maggie, you're doing a great job. Thank you. Et je voudrais aussi saluer mes collègues parlementaires qui sont présents, on les a nommés tantôt, et aussi mon collègue Ralston King. Ensemble, nous travaillons très fort pour la communauté et on sait qu'il y a tellement de besoins. Et aujourd'hui, today's a day where it's important to share with our colleagues that dental care plan is really important for our members. Et c'est une journée pour célébrer cette étape importante du régime canadien de soins dentaires, Je voudrais aussi souligner ce que cela signifie pour les résidents de l'Ontario et bien sûr, comme j'ai dit plus tôt, pour la communauté ici dans la région de la capitale nationale à Ottawa. And as Minister Michel mentioned, the Canadian Dental Care Plan is now putting oral health care in reach for 5 million people across the country. And I'm very pleased to announce that here in Ontario, this means it's more than 2 million people that are now approved for coverage under the plan. Over 1 million Ontarians have received care. And I have to tell you, while I door knock, because we do, I stopped by Kilry Denturists. The Kilry brothers are telling me how this is a game changer for many seniors that come to their office. And they also go across the city to serve. Et c'est incroyable de voir comment les deux Kilry font toute une différence et que les gens que j'ai rencontrés le disent. J'ai plus besoin d'attendre. J'ai vraiment accès à des soins qui sont bucco-dentaires qui font toute la différence dans ma vie. Et comme je dis, ça permet aussi d'avoir un meilleur accès à des soins dentaires abordables pour des millions de nos voisins et voisines dans cette province et ici même à Ottawa. À un moment où le coût de la vie augmente, la tranquillité d'esprit qui vient du fait de savoir que nos besoins en matière de santé seront comblés n'a pas de prix. Of course, none of this would be possible without the support of oral care providers. I want to extend, as Minister Michel mentioned, my heartfelt appreciation to all dentists, denturists, hygienists, and specialists who are participating in the CDCP. And I also encourage youth and others to join this movement of this sector because there are opportunities and we're always looking for more that can work in that domain. And this program is only possible because of that commitment and participation of providers across the country. The Canadian Dental Care Plan is just one way the Government of Canada works with partners to make life better for Canadians. Alors, comme je disais, ça améliore la qualité de vie des résidentes et des résidents du Canada. C'est un des programmes qui est le plus populaire lorsque je suis au bureau ou encore lorsque je fais du porte-à-porte. Et j'ai même décidé de faire des brosses à dents pour pouvoir les partager. Donc, il y en a ici pour ceux et celles qui aimeraient en avoir. Merci beaucoup et bon après-midi.
Thank you, Mona. And now we are at the Q&A portion of this event. I'm going to turn this session over to Emmanuel to monitor.
Donc, on va passer à la période des questions. Pour les médias, le micro est juste de l'autre côté. S'il vous plaît, dire votre nom, le nom de votre média, à qui s'adresse la question. On a Lindy de Santé Canada qui peut répondre aux questions plus techniques. Et il y a beaucoup de gens qui doivent partir. Donc, on va faire ça rapidement, s'il vous plaît. À 9h30. We will now move on the media Q&A session. We will take one question and one follow-up. Please state your name, the name of your media, and whose question is for. Lindy from Health Canada will respond to more technical questions, and several MPs have to leave at 9:30. Thank you.
Thank you. Rachel Aiello from CTV News. Minister, your predecessor, Mark Holland, had said that he wasn't going to stop until there was 100% pickup from providers. I know today you're highlighting the around 5 million Canadians who are accessing this, but do you have numbers on the dental care providers, denturists, dental hygienists who have signed on to this program? I know there was some resistance because of the administrative burden.
Well, maybe I would turn to you. I don't have the number, but what I know is that the enrollment worked very well. So as I said in my speech, the number of dentists who are participating to this program is growing more and more. And if we can reach to the more than 5 million people, it's because we have more and more providers. As you know, we have also to address, people living in rural region, northern region, it's more challenging, and we are getting there. We are putting a lot of effort to make sure that every Canadian can get access to dental care.
And as a follow-up, in the work you were doing over the summer as part of the overall spending review for the federal government, can you confirm that you have not recommended any cuts to dental care as part of the suggested savings the federal government is after right now?
Yes, dental care program is one of the commitments that our government did when we win the election in April, so it's still moving on. We have no,
reductions to the program.
as it is running now.
Do you plan to expand it?
Excuse me?
Are there any plans then to expand it?
Well, we'll see.
Hi there, Minister. Marina von Stackelberg with CBC News. 5 million Canadians signed up for this program, but only about half have actually gone to see an oral health care provider. How do you explain that discrepancy, especially when some of those people would have been able to apply half a year ago?
Well, I think two things. It's still a new program. The fact that people are enrolling to the program and the fact that we have more than 5 million people accepted by the program, it's a good news. Now the program is available for them. It's like, you can go to your doctor and you don't feel the need to go tomorrow morning, but you still can go to the doctor. It's just the same. This is how I see it. So people have their little card in their hands and they will reach out to their dentist when they need. So I feel to have people enrolled in the program is key for them to have the opportunity to go.
Many patients that I've spoken to say that a concern they have with the program is the balance billing part. So that basically allows a dental clinic to charge more than what the federal government will reimburse them for. Sometimes it's more than what the provincial fee guide is as well. So I'm curious if you would consider putting any sort of restrictions or limits on what dentists or oral health care providers can charge people for these services. I think previously a lot of people thought this was free health care, but there are still a lot of people who say they are really surprised when they see the bill, and it's a lot more than what the federal government is reimbursing the dentists for. So would you consider putting any sort of limits or restrictions on dentists and oral health care providers?
Okay, so let me be clear. It's a new program. It's a program we built as
well, it's a year and a half old. It's a year and a half old at this point.
Yes, but it's still new. It's a new service that we are providing to Canadians, and we are working with a company to making sure that we are providing the services. We are monitoring very closely how fees are applied to patients, and my department is working closely also with the provider, to make sure that we can understand the cost, why the costs are applied, and we will improve within the time. If I'm considering putting some, restriction, I wouldn't say this for today, but it's still a work in progress.
Morning, Minister. Sarah Ritchie with the Canadian Press. I'd like to ask you about the pharmacare program. Does your government intend to implement a universal pharmacare program beyond the agreements with the provinces that exist right now?
So, we passed legislation. So, in principle, we agree on a pharmacare program. We have four agreements with the provinces. We are monitoring them. We are evaluating them. As you know, the context right now is very difficult financially for every government. But I can assure you that I'm continuing conversation with my counterparts in provinces and territories to see how I can help them meeting their needs. Because what I always say, when we launched the pharmacare at the beginning, we are offering two, like diabetes and contraceptive, but not all provinces wanted to have diabetes and contraceptives. So I'm still talking with my counterparts to see how we as a federal government can better support them in their healthcare system.
For my follow-up, I'd like to ask you about the situation on the ostrich farm in British Columbia. I know you've been doing a lot of briefings about this. I know there's a Supreme Court decision that's about to come down about whether they're going to hear this case, so I'm not asking you about that at all. What I'd like to know is there was a report yesterday from a neighbor of the farm who said that she was assaulted by some of the people who are there. The CFIA is obviously conducting an operation on the farm, and there are a lot of supporters of the farm there as well. Are you concerned about the situation and about the safety of the people who are there?
Of course, I'm concerned by the safety of all Canadians, and particularly when there's a a problem somewhere. As you said, I'm not going to comment on the topic because it's in front of the court, and we will see what we can do. But you need to know that CFIA and RCMP are present on site, and we are doing all we can to protect the neighborhood and the people on the farm. Safety first.
Merci, ça met fin